Welcome to the recording of Dr. Zali Yager's talk for the School of Psychology seminar series on body image and motherhood, making research real. Unfortunately, due to technical difficulties, the audio for Zali's self-introduction is missing, but I'll give you a brief overview of this before you hear from Zali herself. Zali is one of the leading experts in the field of body image, and after 16 years in academia, Zali left this to found her own company. So now Zali is the co-founder and executive director of the Body Confident Collective, which is a research impact social enterprise that facilitates research translation. Zali had an intense frustration at the fact that researchers have incredible knowledge, expertise, and evidence-based programs that never reach the real world. To address this, she started to incorporate design thinking and capture practice-based evidence and promote evidence-based practice. Her work now shifted to revolve more around the development, evaluation, and dissemination of the sorts of resources and programs that people actually want and need, rather than what researchers and experts want to give them. Zali has led multiple studies in relation to body image and motherhood through the Body Confident Mums project in Australia and in Europe, which is funded by the Erasmus Plus grant. Zali was also the expert advisor on the Embrace Kids documentary and has recently co-authored a book for parents on how to support their children's body image. And this book is called Embrace Kids, and it was co-authored with body image advocate Taryn Brumfitt. Zali's work is also informed by her experience as a mother to 3 children, one aged 10 and twins aged 7. Zali travelled all the way from sunny Australia to chilly Ireland and joked about the multiple layers of jumpers she needed to keep warm in her winter weather. And Zali begins her talk about talking about body image in women across the lifespan before talking about motherhood more specifically. And this is where our audio picks her up.
So when we're talking about across the lifespan, what we tend to see is that, women, there is this low point in adolescence where people tend to feel negatively about their bodies, but then as they move into their 20s and onwards from there, there's not that much of an improvement, and we have so many less resources and services focused on this time span. And it was seeing something similar to this at a conference. I was there with my colleagues, Ivanka and Laura Hart, who are my collaborators on the Body Confident Mums work. But I think we were there, we were escaping having young children. So the kids might have been like 2 and 4 or something. And we were like, let's all go to a conference. And so we went to the conference seeing something like this. And we were just like, did they ask if they had children or not? Because a lot of the lifespan research kind of tends to report on all this data without really knowing. And of course they hadn't. So we kind of were like, oh, should we do something in that space? At the time, there was very little research on motherhood and body image. So we kind of just started this thing that has grown into this huge kind of, this huge body of work. And I just want kind of, when I was putting it all together, I was like, oh, we've actually done a fair bit. It usually doesn't feel like you've made any progress, but I sort of put it all together. I was like, all of this looks so coherent when you put it in one presentation. But I just wanted to like be real in the fact that we never really knew where it was going, and none of it was like planned out in linear steps. So I just kind of wanted to introduce that as the context for some impact work. You have to be open to the opportunities that arise rather than sort of necessarily having a 10-year plan and just stepping forward with those things. Let me just check. Yes, everyone's okay now. All right. So we did do, and I didn't put the data up here. It doesn't, one of the earlier studies that we did was comparing women who had children and women who didn't have children, because we were like, well, if we're going to look at motherhood, are mothers any worse or better off? And it's the question the head of school just asked me, and so I remembered that I should talk about it. But it's one of the things that, in terms of getting funding and things, it's like, oh, it'd be really great if we knew that mothers are worse so that we could argue for a grant to work with this population. We did a study with mothers in the community. So it was a sample that we got through social media. And we looked at women who had children versus not having children who were in the same age range. And the women who had had children were actually better off in terms of their body image. And the women who had not had higher levels of things like self-objectification and body dissatisfaction, drive for thinness. And so that kind of didn't help us get any grant funding, but I think it did help us to narrow down kind of some of the opportunities of working with mothers, in that mothers' appreciation of their body functionality was so much higher than the women who had not had children. And you know, the rationale that we give is that, you know, suddenly your body does things and it's not just about the way that it looks anymore. So that was kind of some nice learning that we took from that research. And so the body image research in terms of body image in pregnancy, it's really mixed, and it feels like someone does a study and it finds one thing, then someone does another study, it finds another thing. Some had improved that body satisfaction improved throughout pregnancy, others reported worsening, and it kind of just seemed to depend. And then someone did a really nice study where they actually looked at different, it's probably too small for you to read, but different sort of aspects within body image rather than just asking about satisfaction, dissatisfaction. So if you see here, like preoccupation with attractiveness stays exactly the same. Dissatisfaction with strength is the thing that increases. Preoccupation with body size was the one that decreased. And then what's this one over here? Overall body image score stays exactly the same as well. So there's different parts of body image that is improving and changing over time, which is why we get that sort of variation, I think, when we're asking about how people feel about their bodies. My screen is full of all the Zoom bits.
Sorry, can I just ask, do you take into account the number of previous pregnancies that someone has had in that previous?
Yeah, we tried to. It's really tricky because I also have a lot of friends and colleagues who have adopted children, and it was this challenging thing of not wanting to exclude people because they are mothers, but wanting to look at the impact of pregnancy, birth and breastfeeding, and how many times people had gone through that process. But yeah, it was generalizing, like first-time mums were in a better position than mothers with multiple children. Yeah. So there are some of the reasons why people might feel better about their bodies in pregnancy is that this is kind of the one chance that you get to be kind of excused from conforming to what we, you know, generally refer to as like societal ideals of attractiveness. And the embodiment, as I mentioned before, like your body takes on this higher purpose, so you can therefore appreciate the functionality that is going on. But as soon as the baby comes out, there is a whole lot of pressure to get the pre-baby body back. And this is something that is much worse for people who are in larger bodies at a higher weight, or, you know, technically sort of further away from those ideals. For women who have issues with functionality, you know, in general, in motherhood, but particularly postpartum, which is classified as the 1 year after birth, there's no time or energy to do anything in relation to coping, self-care, and, you know, physical activity. Mothers are also quite wary of impact on feeding, and so there's all of these things that sort of come into this consideration of body image after birth. And so some of the, and I'm mixing up here because I like some of the qualitative stuff because it can really nicely describe what's going on. But you know, some of the participants say like having the big tummy during pregnancy was great because everyone could see, and it was that indicator of pregnancy, it's really celebrated. But then, you know, she was talking about going out without the baby, and then people, you know, judging her based on her appearance and without the baby as the kind of reason for that, in terms of, you know, the change in her body or the way that she looked. And so there's been some really nice content analyses of the coverage of postpartum in particularly in magazines, but also on social media. And, you know, the amount of focus that is on regaining a body, or, you know, going back to something that was there before, is just so, so significant. And so that then does contribute to a lot of the expectations that women have about their bodies and what will happen afterwards, but also contributes to a lot of the dissatisfaction that they feel if that's not happening or happening too quickly. And so this was from a participant. We did some really nice interviews, but we didn't actually publish the data because we were doing it just to really learn and do some sort of user engagement around the space. But there's all these sorts of connections between, you know, feeling the discomfort of the size, but also then having that association between it making you feel like you're then not doing it right. You know, you're failing, you're not being a good mother because you don't look like you've got everything under control. And that was something that did come up quite a lot in some of the earlier interviews that we did. And that's why I think what really helps us to reinforce the need for resources in this space, because we don't want mothers to feel like they're failing because of their expectations around the change in their, and this is in particular around weight and shape, not necessarily overall appearance. So in general, the research kind of tends to show that the postpartum body image tends to be worst at sort of 6 to 9 months postpartum. And in the US and in Australia, that's typically when mothers are going back to work and sort of needing to move back into that space of you're fitting into your work clothes, but also being seen without the baby with you. And that's a little bit different in some of the Nordic countries. We've just been doing some work over there, but the Western research tends to show that as being one of the worser parts. So it often gets missed in a lot of the sort of health services research that tends to focus on that very distinct period of time after birth. And some very nice research, Lovering from the US, found that you know, when they surveyed postpartum women, they actually wanted to be not just going back to their pre-baby body, but it was sort of like 5 kilos less than that. And I think it's that standard that whenever we ask people, or even to see on social media, a lot of it is about just being 5 kilos lighter. And it's interesting, I think, that that was to their pre-pregnancy weight. So just in general, something that I like to add is that, you know, in all of the research that we have around body dissatisfaction, sometimes when I'm talking to generally people in the general public, they tend to think that there is a good reason to be dissatisfied, because there's this misconception that if we weren't dissatisfied with ourselves, then we wouldn't look after our bodies. And all of the research now is showing a very clear association between having a higher level of body dissatisfaction and then avoiding physical activity, having higher levels of depression. With the adolescent data, it's a 24 times increase in depression, concurrent depression, in gaining weight over time. So a lot of people think that if you're dissatisfied, then that will help you to maintain a stable weight, but the really nice longitudinal research from the US shows actually the exact opposite, and we have more weight cycling and more weight increase over time. And things like cancer screening as well, things that are sort of a bit more distal to actual weight and shape. But there's even, I think maybe it's on the next slide, that people are, and I didn't include it in there, there was a really nice study that showed people who are dissatisfied with their bodies are less likely to wear sunscreen, which probably less certainly in Ireland opposed to Australia, but it's the little things around looking at, I generalize all of that as like looking after your body. So in general, the women who appreciate their bodies are more likely to engage in the physical health behaviours that's going to look after their bodies, basically. And in relation to motherhood in particular, we find that there's great engagement in and duration of breastfeeding, which allows us to make those really nice connections with infant outcomes as well. So my collaborators and I started a systematic review a very long time ago. And I say started, anyone that's done a systematic review knows that like they take forever. Like I've got a systematic review that is as old as my oldest child in terms of like, it's still not published yet. And then you have to keep re-looking at the data. So anyway, we started a systematic review and analysed the data for this infographic that was included in a poster, but it was kind of like we learned what we wanted to learn, and it was like, I really didn't want to have to go to the effort of publishing it, but anyway, it's still happening. It's under control, someone will do it. But for us, this was a really nice demonstration that between the association of health outcomes and body dissatisfaction in pregnancy and postpartum. So we looked at all of the different studies and found that body dissatisfaction, number one, was associated with weight, in that higher overall weight and or BMI was related with body dissatisfaction, and that increased body dissatisfaction was associated with depression. In all of the studies, like there was one where it didn't with depression. But for us, that was enough just to be like, these are some of the two major health issues. And, a lot of the other things are also, there's a whole research area on each of those things. But for us, we really narrowed in on the top two there, just saying like there's really clear evidence that body dissatisfaction is related to these two outcomes, to the mental and the physical health outcomes. And so we came up with this idea that we're calling the body image nexus, only because we don't have a better name. If there's anyone who has a fun name, tell me. But we kind of think that, and again, paper is coming, there's enough evidence that shows us that body dissatisfaction predicts and is also related to postnatal depression. And there's enough evidence that shows that body dissatisfaction predicts, this is gestational weight gain. And in a lot of cases, it's mediated by body image concerns. So we're like, there's something going on here. And I'm a very visual person. I like to have, this picture that actually, when we're talking about, these two things usually exist in separate buildings in the university. There's the people who do the weight gain and pregnancy stuff, and there'd be the people doing the P&D stuff. But actually, these two things are very related. And the behaviours that you engage in, that you might be more likely to engage in because you have a more positive body image, would then be like helping preventing the P&D and the gestational weight gain. So it's just this kind of early model, but all of these things are interrelated. And that also helps us when we go to do some intervention. So I'm going to talk a little bit about weight and weighing in pregnancy. Can anyone, so people who have had babies, do you get weighed in Ireland when you go for your booking an appointment?
Yeah, you do. Yeah.
Depends?
It depends on the nurse.
Ah, yes. Okay. So in Australia, it comes and goes. Like it's sort of like, yes, it's in, and then no, it's out. But it's just come back in. It's been policy that you're offered to be weighed in every appointment. And so I'm quite interested in the research here, and there's some really nice work by a midwifery researcher, Shanna Feely, who sort of was saying like it's really easy for the nurses to do, but it's actually not in and of itself. It's not a standalone intervention. It doesn't actually impact on weight outcomes. And from a body image perspective, we think that weighing in women in pregnancy can be quite triggering, particularly because it's sort of like an official building and you're in the context of healthcare, and it's guaranteed that weight is going to increase in pregnancy. And when we think about women's journeys over their lifetime, whenever that is happening, it does tend to trigger sort of certain feelings and emotions. But also for the, some of the statistics that I have used sometimes when I'm talking with midwives is that up to 30% of women probably had like even some sort of subclinical eating disorder during their adolescence or in their 20s. And so when we're thinking about those women kind of moving through that space and, either adapting or going through some sort of treatment or recovery process, and then kind of rocking up at the point of pregnancy and being asked to get on a scale, sometimes that's the first time that's happened in about 10, 15 years. And sometimes that can sort of be a re-triggering event that can arise in that appointment, and often they wouldn't say anything to the nurse. So I think that we do need to consider that. And in particular, this is a paper that is a qualitative and ethnographic study by Jenny Lee, and she talks about she identifies as a fat woman, she's in a larger body. She says that when fat women are told that their bodies are to blame for all of the negative outcomes in pregnancy, and they are shamed, the shame leads to hiding and silence, and contributed to anxiety and depression. I think this is a really important point to make, that I'm talking about women across, the whole spectrum of bodies, but the situation is in particular worse for women who are in larger bodies. And what we tend to see then is that women avoid healthcare. So if they go in and they feel shame in that appointment, it's just highly likely that they're not going to go back again. And some of the research that we have now is that actually a lot of the conversation around, I don't like using the word obesity, but I kind of need to say it so that you know what I'm referring to, but we call it like the O word. A lot of that, the first line of any newspaper article is like talking about the weight issues that are associated with that. But a lot of the research that's coming out, and this isn't like the latest stuff, but this is like, in the mid 2010s, was saying that actually it's the weight discrimination that people feel that is contributing to those health outcomes, not necessarily the weight itself. And this was really nicely put together in a recent study that was looking at gestational diabetes, and found that weight stigma concerns, for example, like scoring highly on the question of I'm worried that people will judge me on the basis of my weight, were a greater predictor of gestational diabetes than BMI. And I think that's where this research needs to go in order to convince some of the policy change that we need. I meet all of resistance when I hit this part of the talk. And it's not that I'm saying that, anything about weight and health. What I'm saying is that when we tell people that they're in these certain weight categories, then they're going to be engaging less health behaviours, they're going to gain more weight over time, and they're going to have that stigma that leads to those health implications. And so I'm not really talking about whether it's healthy or not. I'm trying to say that when we make people feel bad about it, it doesn't help them to be healthier. And I think that's the distinction that we can make in some of these arguments. So switching to, so there's connections between BMI and the depression and anxiety, and I've just realised that this talk is way longer than the time that I have, so I'm going to kind of proceed through these associations, but basically large data sets all over the world showing connections between body dissatisfaction and postnatal depression. To the point where the risk of perinatal depression was 4 times higher in women who are dissatisfied with their body. And these sorts of, I like to include these bits because they're basically the ones that are like, when people think that body image is like a niche issue or like a trivial thing, or like they kind of associate it with like fashion or something, it's like, no, it's actually really, really an important issue, to the point where the researchers recommended that we screen for body image at 16 to 20 weeks gestation in order to provide early intervention for PND. And so that's become sort of part of our recommendations. And so just coming back to this, I'm going to sort of switch to talking about the sorts of interventions that kind of provides, I guess, just the overall picture of some of the research in this space. And let me just skip through the impact on children because we don't have time for that. But basically, all of this, the early stuff was talking about the impact on mothers' physical and mental health, but we found that actually role modelling to their children was then highly related to mothers' own body image. And so the argument there is that women will have higher physical and mental health, but also be able to create more physical and mental health in the next generation if we try to improve their body image throughout pregnancy. And so coming to, I guess, some of the kind of solutions, this kind of content is what has gone into some health professional training that I recorded in my house and then got sent all over Europe as part of an Erasmus Plus project. So that's been translated into 9 different languages to educate health professionals about some of those associations, to try and unpick some of the assumptions and biases that might be driving some of that stigma in healthcare. We also use that content to come up with some practice recommendations. So this is getting to the point of wanting to have something to hand over to people to summarise all of the research, but then also make some practical recommendations about what they could do. So this is for perinatal healthcare professionals and kind of gives this series of recommendations that are based on all of this research that kind of puts it into more practical terms. And so it's sort of I think it's like 5 or 6 page document that just focuses on these practical things that they can build into their work with women. So being aware of women's prior experiences, thinking about their past history, and then actually screening for body image concerns. So asking the question, how are you feeling about your body at the moment, or how have you felt in the past about your body changing? Using body confident language, which we're kind of at the moment is just not being stigmatizing and not being sort of shaming. Particularly in pregnancy care, there's a lot of kind of words that are unintentionally really blamey on women, like incompetent cervixes and excessive gestational weight gain that kind of have a lot of judgment built into them. So we're just trying to shift some of that language. We do talk a lot about weighing in a body confident way. We've come up with a little process that I'll show you that we're kind of trying to, if they're going to have to weigh people, then let's talk to them about how they can do that and manage that process. And just to overall focus on health behaviours rather than weight, and manage expectations about what bodies might look like after pregnancy. And then incorporate and refer to some program materials if they've got time to do that. So this is the kind of process. It's yet to go to a designer. This is my attempt to put it into something that that people can use to visualize and just to say, like, here's some example words, here's some steps that you could take. If you're going to have to weigh women, let's do it in these certain ways. Let's explain why, because no one really knows what happens in anyone else's appointment. So let's explain to each woman why you're going through why you're doing some of these things, because it's a larger policy. I've also created this tile that we've put on Instagram for women, and it's something that we were thinking they could save to their phone. So then when they go in for the appointment, sometimes it's a bit awkward to try and say, don't weigh me, so maybe they could show it instead. And the QR code then leads the health professional to our guidelines so that they can sort of link them up, and it's not that woman's job to explain all of the research. They can find that. And so then when we come to sort of the interventions and the programs and the materials for women, in terms of the research, it's showing that there are sort of these 3 broad areas that are quite effective with adult women. One of them is, of course, self-compassion. There's a bajillion articles on it now, but it's not actually common in practice. It's sort of one of those things that's still in the research pipeline. Physical activity is actually something that can improve body image, and everyone goes, oh yeah, but that's because it changes your body. But it's not actually because of that. It's because you gain feelings of strength and of achievement and of appreciation of the functionality of your body. The other thing that's emerging is functionality journaling, and this is a lot of Jess Oliva's work that I'll talk through in just a moment. So the physical activity stuff is huge, and we just have a bunch of papers on this where we're trying to look at what can promote physical activity for women, for mothers. And it's kind of this impossible population to work with because they have no time or energy and kind of want to do it, but then have all these barriers. So I just wanted to show this because we did this really nice, I like the latent profile analysis, kind of coming up with these profiles of women because there's a lot of focus, particularly in Australia now, on user engagement and on asking people what they want. But when we ask people what they want, we need to make sure that we're asking a range of people from the different profiles so that we can ensure that we're meeting everyone's needs and not just, the needs of a particular group. So this is some of the body functionality work The Expand Your Horizons program is a journaling program that's Jess is based in the Netherlands, and kind of asks these questions just to get people to think about what their bodies do for them. So it's in terms of like your senses and everyone sort of thinks about it lets me run and jump and walk around. But then also like your body heals itself, and it allows you to interact with other people. So even just writing about this for 10 minutes improved body image for adult women. The problem is that people hate writing and it feels like a lot of work to them. So we've been sort of playing with how can we put this in other forms. But it's kind of captured in the Kristen Bell quote, and this is some of the stuff that we sort of put out on Instagram. You know, when I look down, even now, the extra skin on my belly, it's a reminder I've done something spectacular. And that sort of links back to that, what I was talking about at the start of the talk. So Jess is now doing, this is all in Dutch. This is the recruitment poster for a specific study to look at the Expand Your Horizons program in mothers as the writing task, but we've struggled with recruitment to get people to write to do 3 sessions of writing. So it was clear that there was a problem there. Self-compassion, I mean, there's just so much evidence that this is something that is useful for people, you know, in general, in terms of anxiety and depression, specifically to body image. It can be short, it can be a 10-minute self-compassionate letter, and that it can improve things like PTSD, depression, specifically in mothers. And some of the recent stuff out of Canada is showing that self-compassion can lead to mothers prioritising their engagement in health behaviours, which is really nice when we want to see those kind of physical health outcomes as well. So what we did was first was we thought, okay, mums are on Facebook. We're going to create a Facebook challenge. Challenges were the big thing. This was probably 4 or 5 years ago. So we pulled together those 3 the 3 sorts of approaches that were looking like they were effective: the functionality appreciation, the self-compassion, and the encouraging physical activity. And we created this Body Confident Mums Challenge. So there were lots of videos and things that was delivered over 1 week from me pretending to be an influencer on Facebook. And we kind of had little videos and then tried to encourage them to go off and do the activities that were kind of, to us, like the effective part of the intervention. And a lot of this was designed based on the user engagement interviews and focus groups that we've done with mothers, in terms of how they like to receive information and what sort of format and when and how much and all of those questions. And we thought that we'd put all this together and created something that they really liked. But it was way too much information in a short period of time. And very few of them actually went on to do the actual work part of the activity where they wrote the things down on paper or that sort of thing. But they liked watching the videos and commenting and posting on other people's work. So now where we're up to, after quite a long time, is trying to put some of this content into an app. So because we did another survey with mums, and it was it was my first non-university survey, which was kind of fun to not have to do ethics and to just ask people my own questions without using standardized scales. But we asked them, like, when do you access information? How much time do you have? And to sort of get an updated post-COVID perspective on how mums in particular were accessing their information. And the overwhelming finding of that study was that mums only have time for themselves when they are on the toilet. And one of the mums responded to the survey saying, I'm actually on the toilet right now while I'm completing this survey. So we were like, okay, we've got like 30 seconds to maybe a minute and a half to put some of this content into the format that can be accessed in the ways that mums have time to access them. And so this app is something that is coming soon. It contains, rather than necessarily getting mums to sit down and write, the journaling is going to be voice to text so that they can hold their thumb down and kind of record their thoughts, and it will save it within the app and turn it into text that they can review and reflect on later. The recordings, the 10 to 15 minute mindfulness recordings that we were trying to get them to do in the challenge, we've sort of put them into two categories. One of them is pep talks that are less than 2 minutes, and the idea is you can listen to it while you're on the toilet, but they're kind of responsive to common situations, and a little bit broader to just body image. A lot of the women that we either speak to or survey said, like, I'm not that interested in improving my own body image, and it's a bit hard to hear that when it's your research area, but they were quite interested in improving their mood and looking after their mental health. And so we tried to think about how we could package up the things that we know that they need within the context of the things that they want as well. So we've got pep talks, and then we've got some mindfulness recordings. This is part of, I guess, being in the user group yourself. I know if I lay down on the floor and close my eyes, like pets and children and everyone will jump on top of me. So we're trialing, and we've got a university study happening in the US where we're actually getting, there'll be undergrad psych students to listen to mindfulness recordings while they're folding my collaborators' laundry. And we want to test whether listening to, and it's a body functionality recording, so that instead of having to write for 10 minutes, they can listen to a recording that might prompt them to think about the aspects of their body that they might appreciate, and to do all of that while they're also getting household chores done. And in my mind, that's one of the only ways we're going to get mothers to interact with some of this information. So that's kind of all of the Body Confident Mums resources. A lot of this work has also informed the work that I've been doing. Tara Brumfitt, pictured here, is a body image influencer in Australia. She's based in South Australia, and she made a film called Embrace, which is on Netflix at home, and it is released globally. So I don't know if it's on your Netflix, but you could have a go. Have you found it? Yeah. Okay. So the first film in 2016 was kind of aimed at mothers, and we did a little evaluation and found that it was actually really helpful in improving mothers' body image. And so then she's gone on to create the Embrace Kids film, which was just released this year in Australia and will hopefully be coming to Europe next year. But the book that we wrote for parents to go alongside the Embrace Kids film has a lot of the motherhood stuff built into it, because one of the best ways to get information to mums about themselves is when you tell them that it's for their kids. And so the first part of the book is actually about improving mothers' own body image so they can role model that to their children. And then the second part kind of goes through a lot of some standard situations and parenting topics that come up with school-age children. We also launched a website, which is one of the biggest tasks of this year, called the Embrace Hub, and that houses a lot of resources for parents and teachers and coaches that's all freely available and accessible. And that was a really nice opportunity to have some good research translation done in a very broken down and pretty way, but it's all kind of based on all of the research and evidence that exists, but it was very simplified. And then we made a podcast for parents as well, which was kind of about the parenting part as well. So 45 minutes. So that's kind of a whirlwind tour of, I guess, some of the work that we've been doing in this space. And I'm really interested to hear from all of you in terms of how this might connect with your work or with the sort of the application into this context.
Thanks.
And I'm guessing people might ask questions online as well, so I should look at that. Thank you. Thank you.
Does anyone have any questions?
Yes, that was great. Thank you. I had a baby in January, so I can resonate with a lot of it.
Nice.
In terms of the data you showed early on that people's appreciation of the functionality of their body can increase following having a baby. the journey to motherhood is also one where the body doesn't behave for a lot of people, whether that's getting pregnant, staying pregnant, giving birth, recovering from that, breastfeeding. There's a lot of spaces there where you can kind of become newly aware of just how little control you have over your body. So I wonder, is there a subset of women in that data, particularly as you know the age of pregnancy is getting older, so more problems that people are experiencing, is there a subset of people there who that relationship is going the opposite way and people are kind of developing this new kind of distrust of their body and how it works?
Yeah, really good point. And it's not something that we asked at the time, I don't think, but it's something that we've got now more collaborators in the network kind of doing work specific to infertility and body image. Yeah, I think it's a really interesting point. I think by the time we interviewed, by the time we surveyed mothers, they had, I think it was just a child under the age of 10. And so for some of them, pregnancy was like many years ago, and those kind of experiences were also more in the past. And so, yeah, I think that it might have come out less in that group, but yeah, very good point. Yeah.
Mind if I ask you just about the directionality of the body dissatisfaction and depression? So I mean, I don't have any background in this area at all, but it just seemed to me that it's quite a circular relationship. So I just wondered how you kind of separate that out at all.
Oh yeah, no, if you actually look at the you know, each study and what they measured and what they found, and you know, you drive yourself nuts trying to pull it all together. And so I just end up saying there is a relationship there because some studies show that it's like chicken and egg this way, and some studies show the other way, and there's not a lot of consensus, I think. And it also just depends who got funded to do what as to what we know in that space. So yeah, I think that saying that there is a relationship, I think, is the closest we're going to get to that right now. Yeah. Yeah. Yes.
Do you mind if I go back again though to the previous pregnancies and like the number of pregnancies?
Oh yeah.
When you think about the functionality,
Yeah.
In one way, I can understand why younger mothers might, or first-time mothers might be in a better position in terms of body image, because I suppose the more pregnancy you have, the greater effect there is on your body. But on the other way, would you not expect there to be an increased appreciation of functionality the more children you have, with your experience of motherhood? I've not done it myself, but I would have thought that somehow those.
Yeah, we broke them down into the age groups of the youngest child. So we had, you know, the sort of 1 to 3, the ones in the middle, and then the older children. I know it was 1 to 5, 5 to 10, and then teenage years. And it was the mothers of younger children. This is not about the number of children, but the age of youngest child, the mothers of younger children thought that they were doing a better job because the mothers of older children, I guess, are a bit more aware of the challenges of parenting in general, but then in terms of body image, the role modeling kind of area. So yeah, it kind of then got complicated to look at number of children and age of youngest child. We were more focused on that distance from pregnancy and how they were feeling then. But yeah, it's I mean, anyone can have the data set and play if you want it. Yeah.
Do you do anything about translating the research around breastfeeding? Because that's an area, like I've never seen an area where there's such a gulf between the quantity and, more importantly, the quality of the research evidence and the strength of the public health policy and recommendations and this moralized discourse around it.
Yeah.
So I think there's a real public service there in translating what actually can be expected in terms of the benefits of breastfeeding and how to weigh that up against the very real costs that it has.
Yeah, yeah. It's something that I think we would have to collaborate with midwives or with maternal. We have maternal child health nurses who kind of look after that space a little bit more because, you know, we're just body image researchers. Often the practitioners don't love it when we come in and tell them what to do. But I think that there is scope to definitely work with the people who have the capacity in that space. And I always like to find the person who has the voice or the capacity for change, and then inform them with what we know and guide them to make those practical recommendations. So I don't do sort of direct policy work, but just bringing all of the research together is often like the first step, and creating those sorts of research summaries for the people who do make the decisions, and putting that into the cycle of when those kinds of policies and all of the public health regulations are being reviewed too, because often they're sort of cyclical. And so if you have a meeting with them and it's just been done, they're like, don't really want to hear from you. But if you do the translation at that later point, it can be more, when they're open to review, that can be important. But no, we haven't done much in that space. It's an interesting one to work in, and so fraught. Yeah.
Could I ask about body image in the adopted mothers that you mentioned? Like, what was kind of the research saying about that kind of?
That hasn't been in.
Right.
Yeah, because women throughout pregnancy are so engaged in systems that makes it easier to access and recruit them for research studies. Then the mothers who go through these other systems are often, not found in that space. So we just have that problem of like wanting to be inclusive, but then trying to represent the data. The qualitative stuff, when we've interviewed and talked to them, is that there is still the same adaptive response in that you're still tired and you still have no energy and you still have that deprioritization of your own needs compared to the children. But we were particularly interested in that experience of body change. And I think everyone gets a bit interested in that, and then we forget to do some of the other research there. Yeah, but I hope someone does that. Yeah.
Any other questions? Okay, well, we'll leave it there then. Thank you so much.
Yeah.